The topic I'm presenting is regarding knee osteoarthritis, that is a degenerative joint disease that affects articular cartilages and the surrounding bones. And it's a common condition that affects millions of people worldwide, and is one of the major causes of disabilities nowadays. And there are several risk factors, including age, genetics, family history, some medical conditions such as obesity, stress, or diabetics. And the principal symptom is the pain, but also stiffness and swelling of the zone. And these symptoms can become really severe at the point that daily life activities can be difficult for these people, also like only standing up or standing for long periods of time or walking. And there are really I would say low treatment options for this disease. Mostly are focused on exercise, weight loss, or medication for pain reliefs and anti-inflammatories, and eventually surgery in the worst cases. So basically there is the need for a more accurate and personalized approach to the diagnosis, to the early diagnosis of the disease, and for the treatment. And there is the need for a personalized treatment. So, as Reykjavik University, we are part of two European projects on this topic. The first one is the Restore project. That was a project on knee contralation whose aim was to find a new efficient solution for cartilage repair, in particular new nano-enabled technologies. And in this context, our job was the creation of the first knee condral database that you can find at the link restore-project.ru.is. And instead, the SINPAIN project that started a few months ago aimed in the development of new therapies for knee OA treatment. And in this context, our aim is to develop a multi-scale and sensitive patient-specific profile that describes the condition of knee cartilage and bones. So, in the frame of these two projects, we acquired some data, and in particular we performed a recruitment between healthy subjects that are volunteers that present no previous history of trauma or degeneration, and degenerative patients that are basically patients that are on the waiting list for total knee replacement, so they present a severe state of osteoarthritis. And right now we acquired a total of 90 knees, so our cohort is mainly composed by 50 healthy control subjects and 40 degenerative, and they underwent MRI and CT scan. The protocol was standardized for all the patients, and we obtained images, and from these images we extracted several parameters. So basically we investigated both parameters connected to the disease, such as the presence of bone spurs, osteophytes, cysts, and whatever in the bones and in the cartilages, and also parameters related to the images. So we extracted geometrical, densitometrical features, morphological features, and all these features altogether they are analyzed by statistical analysis and machine learning, and we are using these techniques to understand first of all the correlation of this of the analyzed characteristics on the degeneration of the knee cartilages, and then also possibly their significance and their impact on the degeneration, on the development of the disease. And this will lead to the creation of a really profile that is really specific for each subject. So today I'm going to focus on bone mineral density and on muscles. We are focusing on CT scans today. So from the CT we segmented the bones of the knee, femur, tibia, and patella. We extracted the density in ounce-field unit. That ounce-field unit, as probably somebody already said, it's basically a measurement of the radio density of that tissue. We derived the bone mineral density from these ounce-field unit values, and this is a previous study we performed, but we can see that there were differences between femur, tibia, and patella, also proved statistically, and that all the degenerative patients in average presented lower value of mean ounce-field unit density, and this is really in agreement with the problems. Like we know that knee osteoarthritic patients develop more easily, let's say, bone fractures because of low bone mineral density. But today I really want to focus more on muscles, because we thought of, okay, yes, we studied bone mineral density, we studied also lots of characteristics regarding cartilages, but we also know that muscles, like there is a reduced range of motion in knee-osteoarthritic patients, and so why don't study muscles? And so what we thought was to perform a virtual histology. So basically we, on the axial plane, we chose several muscle zones that are reported here. Yes, okay. So basically on quadriceps, on hamstring, and on calf and tibialis anterior muscles. So basically I decided to take the vastus lateralis and medialis, the semimembranosus, the 2 points on the gastrocnemius. So there is one is called central part, it's let's say an upper part, and then a lower part here on the gastrocnemius medial, and the tibialis anterior. And we basically scrolled slice by slice, and we took 1 cubic centimeter cylinder mask, and we extracted from this cylinder mean ounce-field unit, the standard deviation of the ounce-field unit, and we analyzed that. And surprisingly, or not so much, we discovered that okay, in average, the degenerative group always present a lower density with respect to the control group, but for the tibialis, that was almost the same. And this is really interesting to think about. Probably there is a decrease in density in degenerative patients because of infiltration of liquids, or maybe they present a major percentage of fat, so we can investigate more in detail this as a future development. And also the degenerative patients present a higher variation of ounce-field unit in the total cylinder mask. And okay, this was also statistically proved, so we perform a Mann-Whitney U-test, and you can see that the p-values on the mean of the cylinder were always significant for the vastus lateralis, for the hamstring, both, and for the gastrocnemius, both part that I took. And also, you can see here that so the degenerative patients have a median and an average that it's lower than the control group, and it's almost always around 50, as you can say in this free example I reported here. This is 40-50, and while the control group present slightly higher, so it's 60. It's not so higher, but in any case, it's something that can make a difference. And this is our aim, actually, because we want to be able to see something that a doctor can't see, so we want to go more in detail, because we know that knee osteoarthritis is a complex joint disease, and there is the need to a prior diagnosis. And to do this, we can really use medical imaging techniques, machine learning, statistical analysis to do that. And basically, we also, we had pretty significant results on bones and on the considered muscle zones, and we can also improve this technique even more, studying also other parameters. And the collection of the parameters on bones, muscle, and also all the other characteristics that are not reported here today on the cartilages can become a set of parameters that would be really useful for assessing knee OA. And to create the patient-specific profile we were talking about. And this will be really helpful, first of all, for really have a prior diagnosis that can lead to a really, you want not to arrive to the surgery, to the total knee arthroplastic operation. And also then to the development of personalized therapies and patient-specific solution. So, thank you for your attention, and I really would like to thank Vincenzo Cangiano and Panagiotta Orinado, because they work with me on this project. So thank you.